your midwife, Ajua, once again on your screens. Kindly subscribe, like, and share. You can also leave your comments at the comment section. When you subscribe, then you press on the notification bell for notification on every video that we will post. Today we are coming to talk about birth preparedness and complication readiness. Birth preparedness and complication readiness. Birth preparedness is not about buying the items that you need for delivery. No, it entails a lot. When we say birth preparedness, it entails a lot. When we say birth preparedness and complication readiness, it's a strategy that encourages pregnant women, their family, and the community as a whole to effectively plan for birth and also deal with any emergency that occurred during the pregnancy. So it's not just about buying your things, buying your baby socks, your welcome dress, the dresses, the pampers, the diapers that you will use. No, it entails a lot. So whenever you are pregnant, you have to prepare. You prepare yourself, then you'll be ready for anything that will come up, any emergency, because we all know it's not every woman that will carry the pregnancy to term. Some will be aborting on the way, others will give birth prematurely, others will take the pregnancy to term. Some also will go beyond the term, that is the post date. So whenever you get pregnant, the moment you get pregnant, you have to start preparing yourself. And with this birth preparedness plan, it has its own components, or the birth preparedness and complication readiness has its own components. And this component, it includes the desired place of birth. So whenever you are pregnant, you have to look for a place that you deliver. So you will not just be there, then when labor sets in, then you be there, oh, take me to Agogo, or let's say take me to Kaneshi Polyclinic, take me to Kolebu. No, you have to prepare yourself. You must be ready. You know where you will deliver. So let's say you are in Kaneshi, oh, I will deliver at Kaneshi Polyclinic, or I will deliver at Rich Hospital, I will deliver at Medina Pentecost Hospital. You have to know where you will deliver. Wherever that you are in Kumasi, oh, I will deliver at Childbirth Hospital, I will deliver at Confanoche, I will deliver at Agogo Presbyterian Hospital. You should know all these. Then you identify your skilled provider. So let's say you have to know a skilled provider. The skilled provider here means the person that will attend to you must be a skilled, must someone who has knowledge in whatever that you are doing. So you won't deliver in the house. No, you won't just be there, you wait, then when the bus and the babies come, then you just go and point anybody to come and help you deliver. No. So that's why you have to come to the hospital to deliver, so that a skilled provider will attend to you. Someone who has been trained to do this, or someone who has been trained to deliver, who has skills, will deliver you. Then in the preparedness, the birth preparedness and the complication readiness, you have to also save some money, because you can't just go to the hospital. No, you have to save some money that you take to the hospital, because anything can happen. Let's say your scan says, or based on your last menstrual period, you deliver, let's say in December. Now we are in October and labor has set in, or you've developed a complication like high blood pressure, diabetes, or you are bleeding and we rush you to the hospital. You can't say because you are not prepared, it's not yet your time, so you don't have any money. No. So you must be ready. Always you have something small somewhere, that whenever there is any emergency, whatever happens, you are ready to go with it. Then you have, if you have insurance, you have to make your insurance ready. So you have to put it at a place where everybody will see it. So when you prepare your things, the things that you come to the hospital with, the baby's items and you yourself, your items, it must be at a place where anybody that enters the room will see it. Maybe on top of the wardrobe, or at one side, one corner of the room. It should be ready. So let's say you are in the market, at church, at work, or wherever that you are in labor setting, or wherever that you are in there, you develop any complication. The person will just go to them, oh, you just go to my room. On top of the wardrobe or at the right hand side of the bed, my things are there, just bring it. By the time the person, everything is inside, your insurance is in, your antenatal book, everything it's in. When you are going to work, when you are traveling, wherever you are going, you have to go with the antenatal book. Your antenatal book should be with you. So wherever the complication happen and you enter any hospital or wherever that you enter, the book is with you, for the person or the healthcare provider to know what you've done for you and where to also continue from, which is very, very important. Then you have to prepare your essential items for your childbirth. So the things that you need, you get pregnant for 9 good months. So at least by your 7th month, all your items must be ready. The things that you use for the baby's items, your own items, they must be ready by 7th month. And we know most of the complications that start from 7th month. Most of the complications, like the high blood pressure, the diabetes, most of the bleeding, the preterm labor starts from the 7th month. So every pregnant, you have to prepare yourself. By 7th month, the things that you need must be ready. So you just take it, then you go to the hospital. If the whatever happened, the complication that came, if it's something that we can avoid, you avoid. Something that we can manage, you manage it. Then you carry your pregnancy to term. Or if it's something that you cannot do anything about it, that you have to deliver, then we help you deliver safely with your things ready. Then you have to also look for the location of a closest and appropriate health facility. So let's say you are in Kumasi and you want to deliver in Accra. It's not close. So you know you deliver in Accra. By the 7th month, you have to move to that place. You have to move to that place, or if your work won't permit, then wherever that you are, you have to also look for the closest facility, that whatever happens, if it's at night, during the day, in the afternoon, you can go to that facility, which is very important. Then you identify your mode of transportation. Let's say you don't have a car, or your husband doesn't have a car, any of your relatives doesn't have a car. You have to arrange with a taxi driver. You have to arrange with a boat driver, or wherever you find yourself, or if you have a friend who has a car, you arrange with that person, so that in case you have any, when labor setting, or you have any complication or anything that setting, you call the person will come and pick you to the hospital. So whenever you are taking the number of the driver, don't take just one person's number. You can take about 2 or 3. So if you call this person, the person is not around, or the number is not going through, you can call the other person. Definitely you have about 2 or 3 numbers. Definitely you get one of them to take you to the hospital. Then you need a bed companion, someone who will accompany you to the hospital. If it's your husband, very good. If it's not your husband, or during bed, you will go with your sister. You have to let the person aware, that you also let the person know the date that you deliver. So when your days are approaching, you have to be remembering the person, so that in case of anything, you call the person. If it's your mother, you have to let her be aware, so that when the time comes, when there is any complication, you call the person is aware, then the person will come. If it's your mother-in-law, you have to let the person be aware. Then male involvement. Male involvement is also very important. When our husbands are involved in our care or in our pregnancy, it also helps. They also help us in decision making, because most of the time they will be giving us the money to go to the hospital whenever you have any problem, whenever you have any complaint. they are the first, those of us who are staying with our husbands, those of us staying with our husband, they are the first point of call that you tell your problem with. Then they will take you to the hospital. So you have to involve them. And our men, please and please, once a while, follow your wives to the hospital. It's very important. There are some things maybe you tell the pregnant woman, she will even forget. But when you are there, we also tell you your part, what you are supposed to do. So in case there is anything, then you know it's not the woman's fault or something. You are there to help the person. Then also, you also arrange for blood donors. You see, anything can happen during pregnancy. Anything can happen. So you have to prepare for everything. You arrange for donors. Those who donate in case you deliver and you bleed. Those who donate the blood for you. It's a nationwide program, or it's something that every pregnant woman must donate at least a unit of blood before you deliver. So in case you deliver and there is problem, there is bleeding cases, we just give you we just transfuse you with the blood before we look for other donors or other blood to also transfuse. Very, very important. So if it's your husband, you bring your husband to the hospital, we take the necessary examination that we are supposed to do on your husband. We screen your husband from any STIs, other condition that will prevent him from donating the blood to you. If it's your brother, if it's your sister, your family member, you bring that person, then you donate. We screen the person before labor sets in. Then the decision make someone will help you in decision making. It's very, very important. If it's your husband, you have to involve the person in the care. When you are coming to the hospital, you can come with him. If it's your mother-in-law, anybody who will help you in decision making, or wherever labor sets in, whenever there is any complication, the one who will help in decision making, you have to bring the person in. So we also educate the person during antenatal care. We also educate the person. So in case when you come in, based on your complication, you have, let's say you are bleeding, you are having diabetes, you are having hypertension, so we have to rush and do cesarean section for you. You have to induce labor because of your condition. The person is there. It's not now that you are now going to discuss with your husband, or you are going to discuss with your mother-in-law, you are now going to discuss with your family or your pastor. If it's your pastor who will help you in your decision making, you come with the person. So the person is aware. We will explain things to the person. So whenever labor sets in, the person is there. Whatever it is, we discuss with the person. Then we do whatever we are supposed to do on time, so that we prevent any complication, we prevent any maternal or neonatal death. And also, when you report early to the hospital, when you notice any change or any danger signs, it helps reduce most of the complications, and also reducing maternal and neonatal mortality, which is very, very important. So I'll urge all our pregnant women to prepare themselves with this components. It's not about buying the items. No, you have to put all these components together. They are already. Then you have to know whenever any danger signs set in, then you know you report early. Then it will prevent any further complications, or it will prevent maternal and neonatal mortality. Thank you. It's your midwife. Subscribe to the channel. You can also leave your comments at the comment section. You have any clarification, you have any topic you want us to discuss, you leave at the comment section. You like and share. Thank you.